we go. We're kind of getting towards the end of like the things I want to share. And I actually did not create slides for this because I want y'all to pay attention. I want y'all to take notes, write some stuff down. I just kind of put them on my own sticky notes, and I will just share some of the pearls that I have used and I have learned over the years and have shared with my mentees. Several of my mentees last year, they did phenomenally on their sub internships. They like matched at their top programs for psych this year, and I'm like super excited. And honestly, like my goal literally is to help y'all just like be great, whether it's in psychiatry or not. So hope you have your pens and paper ready. So I'm going to share some of the things that you specifically can do as a medical student, whether you are in a clerkship or if you're in a sub internship, to stand out, because you're like, I think of it from the perspective of what do I want my medical students to do that makes my life easier, makes the attending's life easier, makes the patient care better. And that's what all this is going to be about. So see patients. How about that? I have had medical students who literally were like, no, I'm good. I don't want to see no patients. You're not getting honors with that kind of attitude. Like, you really can't. And you probably know some of these people in your class who are like, I am here so I don't get fined. You're not getting honors if you're here so you don't get fined. All right, so see some patients. That's step one. And when you see your patients, make sure that you are thinking ahead to what it is that you actually want that encounter to be. So you are going to have more valuable encounters with your patients if you think ahead, what are the goals of this situation? So let's say, for instance, an example where we have a patient coming in with depression, and because you are a med student who wants to get honors, in your initial interview, you ask the patient what their goals are, right? So that patient with depression said, I want to be able to get sleep. That's what they said their goal is. Maybe you might have some additional goals that you'll offer the patient as well, but the patient told you they want sleep. So when you go into your encounter, you have a few things in mind. You want to check in, is your patient sleeping? Because you're addressing the goals that the patient stated, but then you're checking in on their mood. Are they feeling any better, worse, or the same as they had felt the day before? You want to see, you started some medications. How are they feeling on the meds? Always go in with a goal of why you're talking to the patient, and that'll help your encounter to be that much more fruitful. So that's tip number one. The next one that I have, kind of, this is relating to the function throughout the day. So these are things that really you can help to just make the flow of the day easier for everyone on the team. If you are allowed to write notes for patients and they count in the chart, I know nowadays they're not allowing med students always to write notes, and your notes sometimes don't count. But if they do, write the notes. I mean, you're going to have to do them anyway intern year. Like literally, intern year, your job is to write notes. That's write notes and put in some orders. So the more you get practice on doing them and doing them efficiently yet thoroughly, then you'll be able to kind of just even be a more effective intern going forward. So write as many notes as you can. That'll really help your resident, because your resident is out here running about doing all the things. If you can help them out with like 2 notes a day, trust me, like when I had my med students writing a couple of notes, I was like, thank you, because now I don't have to write 10 notes. I only got to write 8. So that's super helpful for the team. And the more helpful you are, that's the more memorable you will be and the more likely you will be to get honors. So other than writing notes, I think there's some other things that are really helpful that honestly I think a lot of people don't think of, and that's where you really get to stand out. So getting really strong family collateral. So in psych, our collateral is so important because let's say someone comes in with psychosis. The nature of what psychosis means is that the person has a disturbance from reality and that they're not with it fully. So their history obviously is important, but you're going to want to get history from people who know this person well. And not only do you want to get the history, if you are allowed to document it, put it in the charts. When I tell you, like my med students who take good collateral and I like see all of their collateral in the chart of what is this patient's baseline? What are they usually like before they were sick? Do they usually take their medications if this is a chronic illness? What are the patient's goals at home? How much do they engage with family at home? Like when I see a med student who has put that in the chart, I'm like, yes, thank you, because everyone now has the ability to know this information about the patient. You have centered the patient in this care and allowed them to be able to get the best care possible. Another thing that's really helpful, safety plans. So you might not have heard of this before if you haven't done psych yet, but something that is really important in psychiatry is safety planning. So the short version of that is basically you talk about what are behaviors or moods that trigger a person to do things that are unsafe. You ask them about things that they can cope, that help them to cope, people who help them to cope, places that help them to cope, and care providers. And typically, you can just like Google safety plan, and you'll find templates online of safety plans that you can use. So most of the time, well, I'll say this at least for the hospital that I work at, we have to be able to do a safety plan for any patient who's being discharged. So, and especially if they came in with suicidality, we want to make sure that the patient has a plan, that they know what are things they can do to be safe, to try to minimize the chances of returning to the hospital or returning or having a potential suicide attempt in the future. So that's something else. The most recent med students I worked with who 100%, like, I literally was just like, can y'all just come with me on every single rotation? Like, literally, they were phenomenal. One of the things that they did that really stood out and was so helpful in driving patient-centric care was doing scales. So one of the things in psychiatry, because we don't have, like, you know how in diabetes, for instance, you can track someone's hemoglobin A1C over time to monitor their glucose levels. We don't have those types of screeners in psychiatry. What we do have are different scales. So for instance, there are mood disorder questionnaires, or there's like the Hamilton Anxiety Scale or the Hamilton Depression Scale, and different institutions use different scales. So I'd encourage you to check in. There's also scales to track mania. There's scales to track psychosis. And what it does is it allows you to quantify. So using symptoms that relate to specific numbers, quantify the degree of illness that someone has. So when you do those scales, and if you do that as a med student, like, when I tell you, it's so helpful, because, like, let's say a patient comes in incredibly manic. On day one, let's say their scale on like the self-rated Altman scale is like a 20. You're like, all right, bet, like, this person has mania. But then by the time you've given them some lithium, maybe you've started them on a second generation antipsychotic as well. Okay, day 10, all of a sudden homie is at like a 2, and he no longer has this like symptom of mania going on. And what you can show is a quantitative way to measure that, rather than just being like, oh, patient's better. No, you can be like, he came in with a scale of 20, representative of insomnia, talkativeness, da 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 da. Like, you can tell that, and then you'll be like, well, today on day of discharge, his Altman self-rated scale is a 2, showing that he has a good response to lithium and to quetiapine. You feel me? So like, those are the ways that you can stand out. Like, you can be like the med student who said he's better, or the med student who says his Altman self-rated scale was this, now it's this. So again, the scales, really important way that you can stand out. And the last thing that I will really emphasize, well, actually 2 things. No, I'm looking at my Post-its. What else do I want to share? Oh, it is 2 more things. So the other one is having a plan. So I kind of mentioned this before, but the more specific you can be with your plan of what you want to do for the patient, even if you are wrong, especially as a clerkship student, it's okay to be wrong. Just say something. Like, if you want to start someone on an antipsychotic, say you want to start on an antipsychotic. If they say which one, just guess. If you don't have a specific reason as to which one you'll pick, just guess one. Say something that sounds smart. Even if you're wrong, you'll be like, you tried. That will give you more points than just being like, I don't know. Like, just say something. That'll be helpful. And the other thing I have for people who are going into the sub-Is, okay, this is an additional way to stand out. So in addition to regular notes or an H&P, discharge summaries and discharge instructions. If you're able to do that, like, you basically want, right, like the person to say, this student is functioning at the level of a resident. To function at the level of a resident, that means you are writing discharge summaries, you are writing instructions, you are putting in orders, you are writing all of the notes, you're doing collateral, you're doing these scales, you are doing all the things. So the more of these things that you can do, the more you're going to perform at the level above, quote unquote, where you're supposed to be. And that's how you get honors. You perform above and beyond what is expected of you. So I hope that kind of covers all of the things. And as I said, I want to make sure that I leave time for questions. So that's kind of like the meat and potatoes. I have a couple more things and then we'll get into questions. I want to offer ways for you guys to say thank you to me for this session. Honestly, as I said before, I mostly just do this because I want to. Like, I thought of it one day, and I was like, hey, let me just have a session. I like teaching, and I like the ability to kind of talk to more than one person at a time to like get information out to multiple people. But if you do want to thank, ways to thank me, follow me on social media. That's one way. And honestly, I really just like communicating with people. There are some people I've met in real life off of social media, slide in the DM, say, hey, ask questions. I don't always respond right away, but I will always respond. Sometimes it might be like 3 weeks later, but I'll respond. It just kind of depends on how my rotations are going. I'm on Twitter as well. I'm on TikTok, trying to be like the youth and trying to be on TikTok. I'm on there showing a lot of videos related to Christian mental health. So you can feel free to check me out there. A lot of it is like educational videos with a couple of fun videos sprinkled in. You can also check out my blog if you would like to support. My blog is something I've been doing for quite some time. I started it when I started doing psychiatry, because that first day of my rotation I mentioned, I was just like, yo, there's something different about this and I need to be able to document it. So if you go to my blog and you kind of like go to like the oldest post and start there, you'll literally be able to see my journey of becoming a physician just kind of unfold over the course of me blogging. Hey, popping in just for a quick commercial break to remind you to subscribe to my channel and like and comment down below if you're liking the content so far. Hope you enjoy the rest of what's to come, because there's a lot of good information in store. Venmo. I say this because with my blog, like I don't actually use my blog to make money, but like things cost money. So having a website, having an email address that's separate from my other ones, they all cost money. So like if you want to throw me like $1 on Venmo, throw me a $5 on Venmo. $5 would pay for like my email account that I pay for monthly. If you threw me like $10, that would help cover the cost of the domain. Whatever you think you would want to be able to share, I would greatly appreciate it. Not required by any means, but if the Lord leads you, like how they do with collection in church, go on ahead and send your girl $1 if you feel like you want to support me in any way. Another way that you can support, so I actually make this gear that I sell on Teespring, and if you check out my Instagram in particular, you'll see I wear these quite a bit. I mean, I love them, and they're great conversation starters about Christian mental health, which is actually where I'm planning to focus my career. So if you want to support, you can either use the QR code, or if you go to teespring.com, you can search Jesus Plus Therapy, and you can find sweaters, t-shirts, mugs, those types of things on there. Learning resources for you guys. So as I said in the beginning, this is mostly for clinical stuff. Like I wanted to really give you guys the clinical meat and potatoes for psychiatry. I mean, I did fine, obviously, when it comes to my test, because I'm here, but it's not really my strength to like give you like tips and tricks on like how to study. I love online med ed. I think the biggest thing is just knowing what works for you. Videos work for me, so I was a huge fan of online med ed. Obviously, you want to do some kind of question. My school was like pretty partial to UWorld. I think Amboss is another one that people use a lot, but I never used them. I just have only ever used UWorld. And honestly, I can't say, like, I don't know if one textbook is better than others. If you guys have been doing rotations already and you have found like a certain brand of textbook that you prefer, feel free to just kind of like shoot that into the chat if there's like a brand of textbook that you prefer when it comes to kind of just like working on studying for for your like shelf exams and things like that. So the last thing I want to share, actually, and this is kind of like in some ways seems out of left field, but not really. I want to share this before we get into questions. So last year I discovered something called Ikigai, and it is a Japanese concept which I felt like perfectly really just describes how I feel about psychiatry. So Ikigai is this idea of finding something that you love, finding something you're good at, finding something you can be paid for, and finding something that the world needs. So there are ways to find each of those separately, but when you find them all together, that is your Ikigai, or your purpose in life. For me personally, I genuinely feel that psychiatry, and specifically teaching others about mental health and about Christian mental health in particular, is something that I love. It's something that I'm good at. It's something I can be paid for, not by y'all, unless you want to like bless a girl. But it's also something that the world needs. So for me, it honestly like makes me so happy to be able to work with my patients, to be able to share what I've learned with you guys. So hopefully you will all be really great psychiatrists in the future and find your own ikigai in whatever it is that sets your heart on fire.
Hey, it's so good to see that you've made it to the end of this video. Thank you so much for watching. If you've enjoyed it, please share with someone. And I think that you're gonna like this video right here because it's gonna help you to learn more about the topic you just watched. Have a good one.